Individuals born in the 1990s are in poorer emotional health than previous generations. At the same age, new research suggests 90s kids, including the youngest millennials and oldest Gen Z members, have not shown improvements in mental health as they age. Unlike earlier generations, according to a study published Monday, population-level trends in mental health have been declining in developed countries for decades. In the U.S., lifetime depression rates have risen from 19.6% in 2015 to 29% this year, a Gallup poll indicates. The new research highlights specific mental health concerns for adults approaching middle age. Researchers at the University of Sydney tracked the mental health of nearly 30,000 adults from 2001 to 2020. They found mental health declines particularly in those born in the 1990s, and to a lesser extent, those born in the 1980s. There's little evidence of worsening mental health in people born before the 1980s. This suggests that mental health declines in the general population are driven by millennials. Much of the focus has been on the declining mental health of school-aged children and teenagers, expected to improve as they enter adulthood, says Richard Morris, senior research fellow at the University of Sydney. But this pattern is changing, and it's not just the kids we need to worry about. The study, focused on Australia, reflects broader mental health struggles, including in the U.S. Nearly 1 in 5 adults in the U.S. have been diagnosed with depression at some point, with the highest rates among those aged 18 to 24. Young adults are more likely than older adults to experience anxiety and depression symptoms. About half of people aged 18 to 24 reported anxiety or depressive symptoms this year, compared to about a third of all adults. The reasons behind the mental health declines in young adults are complex. Nick Clozier, a psychiatrist and researcher at the University of Sydney, notes, "We're looking for a shared experience that likely affected all generations at that time, with young people most impacted." Potential reasons include pandemic-related school closures, job and income loss, and remote work. The Australian study suggests the rise of social media, declining physical activity levels, poor sleep habits, and climate change as factors. Understanding the context and societal changes affecting young people can help optimize efforts to reverse this trend for emerging cohorts, the study authors conclude.